All right, everyone. We are so excited for this edition of the CHP Spotlight interview series. This time we are joined by Dr. Scott Faucett. Dr. Faucett is a good friend of ours at CHP. He's done so much to help so many of our clients, of our patients, specifically those with hip and knee issues. Dr. Scott Faucett is a local orthopedic surgeon. He's board certified in sports medicine. He's world renowned in a lot of these areas. His clinical focus is on getting active people with hip and knee injuries back to their active lifestyle, bringing years of clinical and surgical training in orthopedic and open surgery to provide his patients with the most up-to-date treatment available. For those of you who want to find Dr. Scott Faucett, his information will be below the video, but his website is scottfaucettmd.com. That's SCOTTFAUCETTMD.com. Number is 202-912-8480. And the email is clinical@scottfaucettmd.com. So with all that said, Dr. Faucett, thank you so much for joining us.
Thank you. It's great to be here.
Awesome. So to kick things off, Dr. Faucett, I'd love to hear a little bit or inform us a little bit about what you do. What types of conditions do you treat, and the types of patients you typically help?
Yeah, I mean, we focus on any patient who comes in with a hip or knee problem. So we see patients as young as 2 years old all the way up to 100 years old, and we've taken care of them. And my philosophy is really taking time to understand what it is that's affecting the patient. Sometimes these are fairly straightforward acute injuries, but even in something as straightforward as acute ACL, how that injury is impacting the patient physically, emotionally, psychologically, economically, all of those, understanding kind of what it is about that injury that's affected the patient and trying to come up with a global treatment plan for that patient, which may include surgery, but also all the other things that we need to think about and take care of. So really taking care of each person as an individual with an injury or with a condition and getting them the best treatment plan to get them to succeed and get them back to their goals.
I love that, and I appreciate you sharing that. And for everybody watching this, that's one of the reasons why we send patients to Dr. Faucett, because we so appreciate that approach of looking at things as more globally as like you said, a plan, as opposed to just, hey, one cookie cutter solution for every person with a particular diagnosis. And speaking of diagnoses, one thing we've noticed at our practice at Cohen Health and Performance is that we've seen patients younger and younger over the years start to present with what is known as femoral acetabular impingement, or commonly known as hip impingement. Can you shine some light for those watching as to A, what that is, and then B, what some of the consequences are of that, and how you help with those types of issues?
Those are great questions. And yes, we are starting to see it, frequently in younger patients. I just operated on a 14-year-old yesterday with femoral acetabular impingement. And I think some of that's coming with the sports specialization that we're seeing, and in terms of the hyper specialization of a lot of our younger athletes, and not getting that diversity of play and experience that puts different stresses on the hip joint. But for those of you who are interested in femoral acetabular impingement, it is a condition in which the bony structure of the hip, whether that's on the femoral head or neck, or whether it's on the socket or acetabulum, that there's some misshapen. And what we see is in the stress injuries is typically on the femoral side. The socket side, generally, we have not determined risk factors, probably more family history related per se. But on the femoral side, we see that the stress of the growth plate is starting to create extra bone to kind of protect that growth plate. Many of you may have known of a condition called slip capital femoral epiphyses, which happens in those teenagers. This is probably on that spectrum in which the growth plate is getting stressed, and the body responds in a chronic nature of laying more bone down to support the growth plate. And the benefit of that is that we have a stronger area that can take the force and not develop that skiffy. But the downside of it is it's misshapen. And so it creates what's called a cam type shape of the femur. And if you think of the cam just like on the locking of the bike fork, the wheel onto a bike fork, same thing is happening in the hip. it's creating extra pressure in the hip joint. And that causes an elevation and tearing of the soft tissue labrum, which sits on the socket. And we can play a little video here I can share that shows that. But I think the key thing is that we see is first is we need to talk about specialization of our athletes and making sure they're getting a variety of exposure and stresses to their hip. We also need to learn that playing through this pain is not good. So in these cases, pain is no gain. And then also early diagnosis and treatment with physical therapy to try and work on spinal pelvic mobility, really to kind of help elevate the socket out of the way. And my colleagues have shown that in adolescence, that type of treatment can avoid surgery, at least in the younger ages. But in some cases, it's just not enough, and that can cause this problem. I'm going to share a little video here of what this looks like. Oh, you disabled. Can you?
Let me give it to you here, as people can see. It's all right. Let's see here. I think I should. All right, so here we go. Here's a video from Dr. Faucett that we'll be able to actually get some insight here. This is pretty exciting. I didn't expect this.
So if you look at this animation here, this is what I'm talking about, is that extra bone on the growth plate right here. And what we see in our athletes is as they're doing these hip flexion motions, particularly the hip flexion and internal rotation, which we see commonly in the athletic move in soccer, football, and most commonly the power skating move, as well as in the goalie, butterfly goalie. It's that constant position and stress that's going to put this injury. And this is the soft tissue acetabulum, and we can start to see that it gets elevated and torn off. And this is what causes pain. The bone doesn't cause pain. This is what causes pain. Now, the reason why I say pain is no gain is once that's torn off, you're going to start to damage the cartilage in this area. And that's not as easily repairable as the labrum structure. So we really want to get to these patients surgically when the tear is big enough that it's worthwhile having surgery, but not so big that we've started to develop cartilage damage in the socket.
Appreciate you sharing that. That is an amazing demonstration of what it is, because and I love those visual aids, because a lot of times it's hard to picture, what's happening deep inside. And as everybody can see, is that Dr. Faucett is clearly an expert when it comes to all things hip related. This is just one diagnosis of many that can occur. And what's really cool that Dr. Faucett is, I'm sort of seeing the nuance in this, and that, it's not like when somebody comes in with diagnosed hip impingement to see you, automatically they're going to get better managing it conservatively, or they're going to get better with surgery. Every patient, as you mentioned earlier, is that individual and is treated as such. And I think that's amazing. Now, also another specialty that you have, another joint that you specialize in treating, is the knee. So just one common diagnosis that a lot of us have probably heard of, and I know we've certainly seen a bunch of, are people with meniscal tears, or meniscus injuries in the knee. And a common question that we get from people is in regards to why some people need meniscal surgery, just like, I guess, similar to hip issues, and why some patients do not need surgery and can manage it conservatively. Can you shine some light for us as to some of the factors that may differentiate a meniscus injury from requiring some surgical intervention versus maybe not?
Yeah, I think there's three key factors when you start to think about meniscus injuries and the treatment plan that we may propose for patients. So the first thing, which is the biggest criteria, is the tear type, right? So there are some tear types that are stable and can be managed and tolerated without surgery. Those tend to be the horizontal cleavage tears that are two flaps on top of each other. And sometimes even a little bit of a degenerative tear can still have that ability to be managed conservatively without surgery. There are some tear types that just don't do well unless you operate on them. And those are the bucket handle or displaced tears. The radial tears, particularly the ones that go towards the attachment or the root. And then some of the complex tears that have unstable flaps that keep getting pushed in and out of the knee joint and cause that mechanical symptoms. So those tears tend to need surgery, and we can try physical therapy to try and manage them, but generally either patients live with it or they get it fixed. And then the third thing is the patient factor, right? So what are they doing to their knees? Someone who's just gardening and occasionally, unless they have a root tear or they're doing fairly low impact, they may be able to manage that. Whereas someone who's trying to run or do competitive twisting sports, that meniscus just does not tolerate that rotation on that femur, and they need to have that taken care of. So those are the three factors: patient factors, tear type factors, and then the last factor is just the general condition of the knee. Is this a degenerative tear with arthritis? Surgery is probably not a good idea. Is this a otherwise healthy knee that just needs to get the meniscus torn? Or also, are there other associated injuries like chronic ACL tear or PCL tear that are going to put the meniscus at risk for injury? And those are the things that may need to be addressed, or may say don't do surgery if they have arthritis.
Gotcha. I appreciate that perspective and that explanation. And what I love is that it's not as simple as a yes or no, black and white answer. You know, so much of, I know what you do in your world and we do in ours is gray, and it's very important to be able to see sort of how multiple factors interact with one another. And you clearly just do such a great job of that. So, you know, you answered, it's funny, I prepared a bunch of questions. You answered a lot of them in these, which is fantastic. But what I still have is a little more general. I'd love to hear your perspective on if there's on what things you wish the general public knew more about in regards to prolonging the longevity of their hips, their knees, that maybe we don't often think about. Do you have any thoughts in that regard?
Yeah, I mean, I think one of the things that we really recognized as we've transitioned into this pandemic and during this pandemic and hopefully eventually out of this pandemic is that, you know, people had their lives on how they were going to stay active. And whether that meant walking to work or going to the gym or playing sports, a lot of those things have been taken away from them, and they had to find other alternatives. And there may have been a period where they were relatively inactive, and people wanted to start investing in being active and trying to be healthy. But the important thing is, when you've had a break, you can't just go and start it up day one. As easy as running sounds, it is actually a fairly complex activity to perform and do well. And as we get older and more overweight, our joints just are not able to compensate as much as, for instance, my 7-year-old who can play 5 soccer games in one day and be fine. Right? We can't do that as we get older. Our tissues need more time to recover. And so it really is important for patients to get in touch with someone to help them with that transition and make it a gradual approach, not just throwing on a new pair of shoes and running 4 miles.
I love that perspective, and it's so cool to hear your how you explain that. And a lot of times, I know what we do is we talk to people about, just like you said, it's easy to go out for, and the example of going for a run, is you just walk out your door and go. But oftentimes we think of, in this example, you know, being fit to run as opposed to, or sorry, running to be fit as opposed to being fit to run. Yeah. And obviously you can extrapolate that to a lot of activities. So this is amazing. So I know you have some patients coming up, but one of the final things I want to ask is how do the people here watching know whether or not they should contact you and seek out your help?
So certainly, if you're starting to have pain in an area that seems to be lingering, and most importantly, if it's starting to affect your ability to perform, whether it's just day-to-day activity or what you're trying to do, then certainly I think I would love to help you and try and get a diagnosis, because sometimes just the diagnosis itself is helpful to restructure the way you're going to work out, maybe give it some time to rest or do things like that. B is, what's the best treatment plan, whether or not that's resting, getting in touch with a physical therapist or with you guys, or even working on a performance coach to get you to the next level, or is it something that is more serious that requires a surgical intervention? And so I think we can come together. And I think one of the things that my team is really great at is we all work together. So I got Maggie, who's my PA. I got Madison, who's my athletic trainer and physician extender. So we can all take this approach, and we are able to reach a lot of people more effectively than if it's just me answering every single email. Here we go.
Yeah, I appreciate that, you sharing that with everybody. What I will say, just full transparency on our end, is one of the most helpful things for us is, I know whenever we send a patient to Dr. Faucett's way, is that I can do something simple as shoot him a text to get some feedback there. And it's not often you get that sort of personalized attention. So I will sort of say that on their behalf. And as I mentioned, anybody watching this, information is going to be available to contact him and below the video, whether you're watching this on YouTube, see it on social media, or via our website. But again, their number is 202-912-8480. Dr. Faucett's website, if you want to learn more, is scottfaucettmd.com, and email is clinical, CLINICAL @scottfaucettmd.com, SCOTTFAUCETTMD.com. So please reach out to him. We highly endorse the work he does. And Dr. Faucett, I really appreciate you coming joining us today and dealing with my technical difficulties to get things started.
That's all right, Zachary. Thank you so much for having us. This has been great, and I really look forward to continued collaboration.
Absolutely. Thank you.
All right.